Hi, I'm Adrienne, an occupational therapist at Freedom Physical Therapy Services. I've written a blog that you can find on our website about the top hand injuries broken down by type. Today, I wanted to go over the 3 most common hand injuries I personally see in the clinic, so that if you or a friend or family member are dealing with any of these injuries, you know that an occupational therapist can help you. The 3rd most common hand injury that I see in the clinic is called mallet finger. Mallet finger is an injury to the finger where the extensor tendon, which is on this side of your finger, is pulled away from the bone. This prevents the patient from being able to straighten their fingertip. When they come to the clinic, they present with their finger in this position, and when I ask them to try to straighten their fingertip, they are unable to. This injury can commonly be treated by using a splint that is worn 24 hours a day. However, that splint will need to be on for 6 to 8 weeks. If it is a severe injury, they may have to do surgery to reattach the tendon onto the bone. The 2nd most common injury that I see in the clinic is called trigger finger. Trigger finger can occur in any of the fingers, however, is most commonly seen in the ring finger and the thumb, and is more commonly seen in women than men. When a patient comes in with trigger finger, they will describe a catching or a locking of the affected finger. They may present with a finger that is stuck in this position and is unable to straighten without some assistance from the other hand. This is because the tendon that runs along this side of the finger becomes inflamed and a nodule or a bump forms on that tendon. That nodule is preventing the finger from gliding smoothly with opening and closing, causing it to get stuck. This injury can be treated both operatively and non-operatively. If you choose not to have surgery, there can be a splint made for your finger that prevents the finger from fully bending. This allows the nodule on the finger to rest and help decrease the swelling and the size of the nodule. The most common hand injury that I see in the clinic is called de Quervain's. This is a tendonitis of 2 muscles in your thumb, which means that there is swelling developed in those 2 muscles. Patients that come to the clinic will often complain of pain along this side of their wrist. This pain is often exacerbated by pinching motions or bending the wrist away from the affected side. One way to test for this is to hold your thumb inside your palm, straighten your arm, and bend the wrist away. If this causes pain, that's a sign of de Quervain's. This can be treated both non-operatively and operatively. Non-operatively, we would give you a thumb spica splint to wear in order to prevent use of that thumb and have you avoid any pinching or gripping activities. Thank you for watching the 3 most common hand injuries that I see in the clinic. If you have any questions, please reach out to one of our clinics at Freedom Physical Therapy and check out the blog on the top common hand injuries.